Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science, JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's lecture, we are going to continue with the neurological examination, and we are going to check on the various signs for meningeal irritation. If a patient is coming to you with any kind of meningeal irritation, then how can we assess that signs of meningeal irritation? We are going to discuss them now. In the patient who is suspected of meningitis, so whenever a patient who is coming to us and we are suspecting a patient is having meningitis, example fever, disturbed consciousness, neck stiffness, the following signs may be elicited. The following signs include neck stiffness or rigidity, Kernick sign and Brudzinski sign. So whenever a patient of neurological disorder, especially meningitis, is coming to you and you are suspecting that particular patient is having meningitis, meningitis is characterized by three things: fever, disturbed consciousness, and neck stiffness. The following signs may be elicited to confirm the diagnosis of meningitis: neck stiffness, Kernick sign, and Brudzinski sign. Number one, neck stiffness. Neck stiffness is not specific to meningitis, but it indicates the spasm of paravertebral muscles. It may be seen in cervical spine. So whenever a patient of neck stiffness is coming to you, it does not always mean that that particular patient is having meningitis, but it indicates the spasm of paravertebral muscles. It may be seen in cervical spine disease or meningeal irritation. So if a patient of neck stiffness is coming to you, it indicates that there is a spasm of the paravertebral muscles, and it can be seen in cervical spine disease or meningeal irritation. The neck stiffness is a protective mechanism. It occurs due to reduced pain during the neck flexion. The neck stiffness is basically, what is it? It is a protective mechanism, and it occurs due to the pain during the neck flexion in a conscious patient. Therefore, it is lost in patient with deep coma. So if a patient of deep coma is coming to you, then the neck flexion is, the pain during neck flexion is lost. Neck flexion, the pain during neck flexion is basically a protective phenomenon which protects from overextension of the neck. The neck stiffness occurs in both meningitis and meningism. Now, how to check for the neck stiffness? You have to perform certain things to check for the neck stiffness. Ask the patient to lie supine. You are asking the patient to lie supine and then to relax the head onto a single pillow. Then support the occiput with both the hands and gently flex the neck until the chin is touched to the chest. Chin is touching the chest. So you are asking the patient to lie supine and then relaxing the head onto single pillow. Support the occiput and with both the hands gently flex the neck till it touches the chin. The chin touches the chest. In case of neck rigidity or stiffness, it is said to be present if bending of the neck produces pain and spasm of the neck muscles, or it may be difficult to bend the neck, or bending of the neck produces lifting of whole of the body like a log of wood. So normally what happens is, if you are flexing the neck and touching the chin to the chest, it is okay, you can do it. But if the stiffness is present, neck stiffness is present, then you cannot do it. And while doing this thing, whole body turns up like a log of wood. The second is the Brudzinski sign. What is Brudzinski sign? As you flex the neck to test neck stiffness, so if you are flexing the neck, then what happens is, watch the hips and knees. In reaction to this maneuver, normally they remain relaxed. So normally if you are doing this flexion, then the legs and knees remain relaxed or motionless. But in meningitis, when you are flexing this neck, then the legs will also be, the knee and the hips will also flex on both the sides. Similarly, When flexing of one thigh or one limb, similarly, if you are flexing one thigh or one limb, leg side, there is a reflex flexion of the other thigh to overcome the pain in meningitis. This is known as the Brooks-Zinsky sign. So if you are flexing leg, then the legs are also flexing. Or if you are flexing one leg or hip, then the other leg is also flexing due to the reflex action. This is the Brooks-Zinsky sign that is positive in case of meningitis. The third is the Kernig sign. How to elicit the Kernig sign? In Kernig sign, ask the patient to lie supine. You ask the patient to lie supine with both the legs exposed and fully extended. So you are asking the patient to lie supine with both the legs exposed. Both the legs are exposed and fully extended. Passively flexing of one leg at the hip and the knee will you are passively flexing one leg at the hip and the knee, and then passively extend the other knee while keeping the hip in the flexion. Then observe the other limb for reflex flexion. It means the Kernig sign is positive. Positive signs means reflex flexion of the opposite limb. So if you are flexing one leg, one hip, then it will automatically cause the flexion of the other limb. This means the Kernig sign is positive. The pain and increased resistance to extending the knee or flexion of the opposite limb indicate meningeal irritation. So if there is pain and increased resistance to the extending knee or flexion of the opposite limb, it indicates meningeal irritation. So this was all about today's lecture, how to assess the meningeal irritation. We have discussed three things: neck stiffness, Kernig sign, and Brooks-Zinsky sign. In the next lecture, we are going to discuss about the testing of the muscle, how to test the muscle. So this was all for today. This session was powered by digital version 2.0, JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.